to introduce you to the use of the new EOHHS Health Workforce Data Dashboard. I am not really going to be able to see you, so holler if there's something you need, and also Ariana, my colleague, will be monitoring the chat as well. So welcome again. My name is Rick Brooks. I work here at EOHHS, and I am, as I said, very excited to share with you our new Health Workforce Data Dashboard. This is the first training we've done. We have a lot to cover. I know there will be sort of a range of readiness, you might say. Some of you, I hope, had a chance to look at the dashboard. Some will perhaps find all of this overwhelming and your heads will be spinning, and for others, maybe we'll be going too slow. So we'll try to find the sweet spot for that. And please do put questions in the chat, and we will attempt to answer them as we go. And if need be, we will hold more trainings. And you may be aware that we're doing another training session, not a follow-up to this, but a second one of these on Friday, June 21st at 11 a.m. But you're welcome to attend that again if you'd like.
I gotta check again because some of them might have come up.
So in brief, a quick overview. The data ecosystem was just launched about 2 weeks ago. It was about a year in the making. And the real innovation here is that we've been able to expand what we know about the health workforce, the licensed healthcare workforce in Rhode Island, by bringing the licensee data, individual records of every health professional licensee or most health professional licensees in Rhode Island into the data ecosystem, which enables us to then match those records with other data sources, and there's more than 20 in the ecosystem, that enables us to actually learn more about those licensees than is collected through the licensure process. Importantly, that data is completely de-identified. It's aggregated. We have no way to identify, nor would we seek to identify a single employer, a single worker, single occupation, anything like that. In fact, as you'll see, when we do data searches on the ecosystem, on this dashboard, any question that produces fewer than 10 results, the data is suppressed, so we don't even see the response, and that's intended to further eliminate any risk of identifying particular individuals or employers. So the dashboard is now public-facing. It will remain public-facing. It is essentially a self-guided tool for you, but we know there's a lot to it, and it might not all be intuitive, so we want to give you the opportunity to take this tour and to ask some questions. If you have further questions when you're using the dashboard, you can absolutely email me, and we will do our best to answer your questions, both about how to use the dashboard or if there's something you're seeing on the dashboard that doesn't make sense to you. If there are additional tools that we don't currently have on the dashboard that or questions that we can't answer currently, we'll take those too. They may require the development of additional tools on the dashboard, and they also, importantly, may require additional data that we don't currently collect or have in the dashboard. So with that, let me get right to it. I'm going to drop in the chat, if you may already have this, but I'm going to drop in the chat a link to the dashboard so you can begin to access it. We're going to walk through all of it, but for starters, I'm going to share my screen. So let me encourage you to, for now, continue to use this screen rather than doing your own exploration of the dashboard. I promise you we will get there and you will have the chance to do that. So
Rick, we can see this side of the Word doc on that page.
Oh, okay, let me see if I can.
There you go.
Is it gone? Okay.
Yeah.
Thank you. So when you click on the dashboard link, it takes you to this table of contents. And from here, we can choose all the different dashboard pages. And just to give you a quick overview, we're going to go to the page called Number of Licensed Healthcare Workers in Rhode Island. We'll come back to this in a couple of minutes, but I want to just use this to show you some of the features of the dashboard, and these are fairly similar on every page. So there's a horizontal menu at the top. Actually, first there's a title on each page to remind you where you are, and it also shows you what you have selected. In this case, we've selected register nurses, and we've selected that from the horizontal menu of every licensed health profession that's in the dashboard currently. And you can see, importantly, that register nurse is the only one that's highlighted in black. And that's how you know. This is very important because this feature can be a little funky. So to be sure that you've selected something, it must be highlighted in black. And as you can see, when your cursor is over it, it doesn't appear in black. So that's confusing. You won't know until you move it away that, okay, that's what I've selected, register nurse. So that's your menu of occupations. There are some other drop-down menus, as you can see on the left: race and ethnicity, age, gender. We can isolate for a particular calendar year. We can also look at school, the licensees by the school that they graduated from. And by graduated from, we mean the school that provided the degree that corresponds with their current license. And we also have industries here. I'm going to say more about this, so I'll hold off on that for now. You also, I want to point out just a couple of other things. When we use our mouse and hover over a bar or a line in a graph, it brings up additional data. Okay, so again, we'll go into more detail on this, but this is an important function, and it provides additional information that you might not be able to, that you wouldn't otherwise be able to see. So again, some highlights. I actually want to mention one other thing here and how we select. So if I want to select, instead of registered nurse, LPNs, I'd simply just click on LPN, and then when I move my mouse away, you'll see that's highlighted in black instead of registered nurse highlighted in black. I can also look at both at the same time. This is very important. To do that, we need to hold down the Control key and then click on the one that we want to add. And now we have both of them. So we're actually seeing combined totals here of LPNs and RNs. Okay, again, we only see that when we move the mouse off the selection. Okay, so I'm going to deselect. To deselect, we do the same thing. So I'll hold it over LPN, and because we're only deselecting one of them, I'll again use the Control key, and now we only are looking at registered nurses. Just a couple of other things. There's a button here on every page that says Clear Filters. So if we've selected race and we've selected something for age, and now we want to just clear it all out, we can clear filter, click on Clear Filters, and everything is deselected. And actually, when everything is deselected, it's actually the same as everything being selected. This total here of 62,000 is it's the total of all these licensees combined.
Rick?
Again, yes.
Sorry to pause you. So for the filters on the side, the race, ethnicity, age group, gender, and calendar, it's the same thing for selecting multiple. You're holding Control,
Yes.
right?
Yes,
Okay.
thank you. So if we wanted to select Asian, we just click on it. But if we want to also add black, we would hold down the Control key and click on black. And now we have both of those selected. And again, if we want to deselect one, we hold down the control key and click on it. It deselects one. We can select all here, as it says, and we can deselect all by either re-clicking on select all, or I'll just show you one other option. Over here, there's a little eraser, and that's another way to clear the selection on that particular menu. Again, if you want to clear everything, click on clear filters, and then you're back to baseline, and you can select whatever you want from that point. One other navigation tool here, I think I've covered them all, is back to contents. So this is how you find your way to other pages. Each time you have to go back to the contents, and then you select on the page that you're interested in. Okay, so we're going to go through, if time permits, every one of these pages, and we'll start now. Let me just show you one other thing in notes. I don't want to spend a lot of time on this, but there are some explanatory notes. It does mention here, for example, how to select multiple options, what I just explained using the control key and clicking at the same time. I will explain this as we go, but there is a drop-down menu we just noted briefly, and I'll show it to you again. That's called the NAICS code, and that is a detailed 6-digit system that the Bureau of Labor Statistics uses to classify different types of employers. The healthcare employer types typically start with the numbers 6-2. And there are 4 major categories of NAICS codes. Sorry, this is weedy, but those are all within the sector called health and social assistance, healthcare and social assistance, and that includes ambulatory, hospitals, nursing and residential care, which includes nursing homes, and then social assistance. There are other places where healthcare workers are employed, obviously, besides those healthcare settings, including in non-healthcare settings like education and government. So we'll go into that as well. I just want to emphasize one other part of the notes here, and that has to do with median annualized wages, which we are going to look at, and which obviously is always very interesting to folks. But it's important to understand that when you're looking at median annual wages in this dashboard, you're not looking at hourly wages, and you're not looking at full-time equivalent. So what somebody earns is what they earn. They might be a part-time worker, they might have 2 jobs, they might work overtime. So in general, the median annual earnings will look lower than you would expect, and that's because they are overall reduced by a large number of part-time workers in the workforce. Okay, so I did put in the chat again the link to the dashboard. I'm going to go back to table of contents, and then we're going to go back to this number of licensed healthcare workers that we were looking at a moment ago. And I'll just describe this in a little more detail. The primary purpose of this page is to show us the total number of licensees, and then how many of those are working in Rhode Island and working in healthcare. I'm going to select Register Nurse. And this shows us that in 2023, the most current year for which we have data, and we hover over this, we can see the exact number, 33182. It's actually shown here as well. That's the total number of licensees in 2023. The green bar is showing us the total who were employed in healthcare settings. Again, that would be those 4 categories that I just described. And the blue bar is showing us the total employed in Rhode Island in any setting. Now, there's a big gap for registered nurses between the total licensees and the total employed in Rhode Island or employed in healthcare. We know that that is because in 2017, Rhode Island left the Interstate Nursing Compact, which meant that out-of-state nurses who wanted to work in Rhode Island or wanted to have the option to work in Rhode Island had to apply for a separate Rhode Island license. Their license from their home state was no longer recognized by the state of Rhode Island. And so we had a big spike in licensees, but not a big spike in people actually working. That remained relatively steady. In 2024, just a few months ago, Rhode Island re-entered the Interstate Nursing Compact. So we do expect in the months ahead to see this number come down significantly as people's out-of-state licenses will now be recognized again in Rhode Island. Okay, I'll just show you briefly if we want to use a filter and we want to look at, let's say, just those licensees who graduated from the University of Rhode Island. We select University of Rhode Island, and suddenly now we see a much smaller total, only around 2,100. And of those, we can see it's a significantly higher percentage who are working in Rhode Island, because for the most part, these are not folks who are living around the country. If we looked at Rhode Island College, we'd see similar 75% of their graduates, a larger number of graduates, 75% of them working in Rhode Island in some setting. Okay, let's go on to the next one. Again, back to contents, and then we'll look at median annualized wages. By the way, pay close attention because in a moment, you're going to get a little quiz so you can practice this yourself. So this is the median annualized wages page. The primary purpose here of this page is to be able to either look at or compare the annual earnings, annualized earnings. So by annualized, we mean we take a quarter and then multiply it by 4 of one or more professions. In this case, we are looking at nursing assistants, so that has already been selected, and those nursing assistants working in a healthcare setting. Again, one of these 4 settings. I'll just point out that under these settings, so we'll just briefly select ambulatory healthcare. Now it's black, so we know it's selected. These subsets become available under the NAICS code that I described. And so we would be able to select one of those and really just look at, for example, the nursing assistants working in home healthcare services, which is now what we're looking at. Okay. This data visualization on the left shows us the annualized median wages just for the ones we've selected. Again, in this case, nursing assistants working in home care. And this visualization on the right shows us the number of folks who are employed in that setting, home care, in that occupation, nursing assistant, and that setting, home care. If we wanted to compare, by the way, we could select not only nursing assistant, but let's say LPN as well. And let's just deselect this for a minute and just select all healthcare. Now we have all healthcare selected, and now we're looking at both nursing assistants on the green line here and LPNs on the purple one. That's showing us median annual wages for both of those occupations. And again, on the right, it's showing us total numbers employed in Rhode Island in a healthcare in a healthcare setting. All right. So now here's your first quiz. I'm going to post it in the chat. And the question is, what was the total number of licensed nursing assistants employed in a Rhode Island healthcare setting in these years, 2017, 19, 21, and 23, which is essentially during and after the pandemic. So I'll give you a clue. You can go to the page that we first looked at, which is the number of licensed healthcare workers. So see what you come up with. I'll give you just 2 or 3 minutes.
Rick, can you put it in the chat, the question?
Oh, I'm sorry. I put it in and I didn't click enter.
Good morning, the Rhode Island Healthcare Association. How may I help you?
Oh,
This is.
Hi, I don't know about anybody else, but I'm not able to make a response in the chat.
oh, that's curious. Ariane, is that something that
This is the first time with us using Teams webinars, but I'll definitely try to figure it out. I thought I selected that you guys could, but
it looks like some people have provided some
yeah, that's why it's funky. But I'll look around, see if I can make any edits.
Okay, I hope you've had a chance to navigate this, and we'll see how you all did. I'm going to post the results in the chat. And taking a look here quickly, again, we're looking at nursing assistants now. So we'll select nursing assistant from the menu, like so. And then we want the number employed in Rhode Island in healthcare. So that's the green bar. So in 2017, if we hover over that, we can see 13,222 were employed in Rhode Island in 2017. In 2019, it was 13,069. 2021, it was 12,628, so it went down. And in 2023, it's back up to pretty much exactly the same as it was in 2017, 13,224 nursing assistants employed in a healthcare setting in Rhode Island. Ariane, is this being recorded?
Yeah, it is.
So folks may be able to review this. Oops. Okay. Let's keep going then. The next thing we're going to look at, again, back to contents and then select menu item, we're going to look at race and ethnicity. Primary purpose of this page is to look at one or more race and ethnicity, and we can compare. So you notice that there's a race and ethnicity filter on the other pages, but when a page is primarily focused on, let's say, race and ethnicity or age or school or setting, that gives us the ability to look and compare at that particular characteristic. So, and then we can filter from here in various ways, the setting or the occupation and so forth. So in this case, we're going to select, well, let's just look at all of them for now. So we have,
Yes.
we are looking right now at LPNs. Okay, so this is the racial and ethnic breakdown of LPNs working in healthcare. So we've got healthcare selected. We have all the healthcare settings selected. At the top, it tells us we're looking at race and ethnicity for LPNs. So you can see as you hover over the percent white, and by the way, we have categories that are things like other and well, in this case, there aren't, but sometimes you can see here on the left, other unknown is also a category, multiracial is a category. And then on the lower left, it shows us the median annual earnings by each race or ethnic category. Of course, these are self-identified. And on the upper left, it shows us the median earnings for the category that we selected. Okay, LPNs and healthcare in this case. So that's the median, 56,000, and here we can compare the median with each separate race and ethnicity. Most of the dashboard pages have on the upper right here a visualization of the total number and the average age amongst those that we have selected. Okay, again, LPNs working in a healthcare setting. Okay. If we wanted to see how this race and ethnicity distribution changes by setting, we might look at, for example, just hospitals. Now, to do that, first we have to unselect or deselect, and then we select hospitals. And you can see it changes quite a bit. So LPNs and hospitals. We can look at it by ambulatory setting. Each time we do this, the distribution, proportions, and the earnings reflect what we've selected. Okay. We're going to move on now to age. You'll see there are some similarities in how these pages are structured. I want to show you here that we can look at, we can combine licensees, and I alluded to this. So here I've pre-selected, we've got the clinical social workers and the independent clinical social workers, two different categories of social work licenses. We're looking at the combination of both. If we wanted to compare them, we would look at, it would depend what we were comparing, but if we were comparing, well, let's see now. Yeah, we would do one or the other separately. Okay, so here we've combined clinical social workers and independent clinical social workers. We're looking at the age distribution of them together by age brackets. Right, this is the proportion by age brackets. These are the earnings by age brackets. Again, similar to the way it was done for race and ethnicity. This is the median earnings for what we have selected. And this is the number of folks and the average age for what we've selected. Again, clinical and independent social workers working in healthcare. If we wanted, for example, to just look at two age brackets, so let's say we were looking at 25 to 34 and 55 to 64, we would select those two. Again, using control click, control select. And now you'll see we're just looking at those two groups. So we're only comparing those, so they make up 100% of what we're looking at, but it's a way to see what the numbers are, because it tells us the number just of those brackets. Okay. Okay, we're going to do another exercise here. Post this question in the chat.
I can
Question is-
respond, Rick.
Sorry?
I can respond to that while you do the exercise.
Kristen,
Oh,
I'm writing a
okay.
response right now.
Oh, you are? Okay.
Okay. Okay, thanks for that. Then I'll just go on to just clarify the exercise. What percent of LPNs were employed in Rhode Island healthcare settings identify as Black? And which healthcare setting has the highest percentage of Black LPNs? See what you can do with this. Okay. I don't know if this is going too fast for you or too slow, but here's the answer. And if you look at the screen, you'll see where it comes from, the shared screen. Again, we have selected sorry, just 1 second. So we have selected LPNs over here. And because we're on the race and ethnicity page, it's showing us all categories. And currently, Black LPNs make up 22.57 of all the LPNs working in a healthcare setting. If we want to know which of these 4 major settings has the highest percentage of Black LPNs, we can go through them one at a time. And the way we'll do that is we deselect them and then click on, for example, ambulatory, and we can see that the percentage of African-American LPNs in ambulatory is 18.29. In hospitals, it's 15.77. In nursing facilities, it's 27.9. And in social assistance, it's 24.18. So the nursing and residential care facilities is the setting in which there's the highest percentage of African-American LPNs employed. All right. Okay, let's move on. We're going to take a look now at gender. So this is a little less complicated in some ways. The primary purpose of this page is to enable us to view and compare earnings and proportion by gender. As with all of these, it can also be filtered by occupation, by race and ethnicity, setting, schools, and years. So we are going to look, we're looking now at advanced practice nurses. We have not yet selected a particular gender, but in the absence of that, it shows us the distribution of male and female. Again, similar to the structure of other pages, in this lower right-hand corner, we see both the percentage distribution, so 90% of advanced practice nurses working in healthcare are female, 10% are male. When we hover over, we see what those numbers are. Coming to the left here, we see the earnings distribution. Again, keeping in mind that these are not necessarily full-time equivalents. So they're affected by the number of people working part-time, but that's the income distinctions between
Rick?
male and female. Yes.
Sorry to interrupt you.
No, please.
Could you hover over any of those green bars in the bottom right again?
Sure.
So that number employed, that's total employed in Rhode Island?
That's female health advanced practice nurses employed in a healthcare setting.
Okay, thank you.
And here's the male advanced practice nurses employed in a healthcare setting. This here is a combination of those two. Again, advanced practice nurses of any gender employed in a healthcare setting.
Right, and that's because you have the healthcare selected on the top left. I'm just reminding myself and also
Correct.
reflagging.
Correct. I'll just note that the same function applies. If we want to look at healthcare and non-healthcare at the same time, we do control and then click. And when we move our mouse away, we can see that now we have selected both. So now we're bringing in advanced practice nurses employed in any setting in Rhode Island, healthcare and non-healthcare. I haven't really talked about this very much, but you can see that not healthcare includes sectors that are not primarily healthcare, but employ healthcare workers like education, government, and employment services, which we included because that's where folks employed in a temporary agency would likely show up. So now we're looking at all advanced practice nurses employed in any setting in Rhode Island. The percentages don't change dramatically, but the totals do. And sometimes the percentages can change significantly as well as the earnings. So let's go now to the next page, which is setting. So here I have pre-selected again the two, actually we've just selected, let's add clinical social worker. So we've got the two social worker categories selected. And we'll look at those. We'll undo the not healthcare. Whoops. Okay, we're going to select healthcare. And then more specifically, we're going to look at how things change, all right? In this case, we can compare settings. So that's the nice thing about this. So if we want to look at, for example, ambulatory and hospitals, and actually, let's also add not healthcare, because we know we have social workers working in government and in education. Okay, so now we have we have both healthcare and non-healthcare settings, the ones that we've selected showing up here in the lower right. So the largest percentage of social workers amongst the settings that we've selected are working in ambulatory healthcare, followed by education. And if we look at the earnings, at median annualized earnings of social workers in those settings, we can see that government and education services appear to, well, have higher median annualized earnings than ambulatory or hospitals. Again, that could be because of the salaries, or it could be because of the proportion of part-timers versus full-timers in those settings. Right. Back to our table of content, we're going to take a quick look at schools. So let's select, here, let's just select CCRI, and we will select register nurse. See, these are just, it just shows us occupations that are educated at, or which people associated with their license. In this case, it's something's a little off there because CCRI doesn't train advanced practice nurses, but somebody maybe listed that as their school because it's where they got their prior degree. Because the primary focus of this page is schools, we are actually able to compare more than one school. So why don't we do that? We'll pick Rhode Island College. And now we are looking at both schools. And just amongst the total registered nurses that come from those schools, 68% came from Rhode Island, from CCRI, and 32% came from Rhode Island College. We can see there's not significant distinctions between the earnings, median annualized earnings of nurses from those two schools. Right, and so that's a quick look at schools. And I'm just going to show you these quickly. They're quite different. And they're a sort of, you might say, of specialty interest. These are just related to the career progression of CNAs. And in some cases, the pathway to RN and the other, the next pages that I will show you. But here we're looking at the CNA career progression. So this tracks everybody who has had a CNA license since 2010. And it shows us the number and percentage of those who wound up obtaining an additional license, a so-called higher license, and how long it took them. Okay, so for instance, there were of the 41,000 people that have had a CNA license since 2010, 4,372 have obtained some additional license. Of those, 1,000 or so became LPNs, 3,200 or so became RNs, a smaller number became advanced practice nurses. We can also look at that by race and ethnicity, and when we do see some significant disparities. So just quickly, let's see. So 10.5% of all CNAs went on to a higher license. But if we just select Black, for example, percentage drops to 8.6. If we select Hispanic, it drops significantly more to 4.9%. So we can see that there are some racial and ethnic disparities amongst those CNAs who progress to a higher license. That said, if we look at, just going to skip this one for a minute, and if we look at the pathway to RN licensure, what's interesting is that even though CNAs and LPNs, which I didn't specifically point out, but CNAs and LPNs who go on to become RNs are disproportionately white, what this visualization shows us is that a higher percentage of RNs who started out as CNAs or LPNs were Hispanic and or Black. So in other words, the CNA and LPN role or license is and has been an important springboard for increasing the diversity of RN workforce. So again, we're looking now, actually, we're looking at, here's all races. So the percent of RNs who were previously CNAs, to look at this one, was 6.9%. But if we look at that, let's just say Black, it actually goes up. So a higher percentage of nurses of color, and if we selected the others, you'd say that see the same thing. A higher percentage of nurses of color started out as either a CNA or an LPN. Again, so serving as a springboard or a career ladder. Just go back to this one briefly. This is showing the career progression of CNAs by the training provider that they where they got their CNA training.
This is a great page. I just want to say.
It's pretty fancy. It's pretty cool. You can select. This is showing us actually. Oh, it's not showing us everyone. I think it's showing us everyone in Rhode Island, I think is how.
Does that just automatically not include ones that is not relevant for because
so
during the selections?
Let me clear this out here. Interesting, it doesn't have the eraser tool. So these training programs are every training program in Rhode Island, and then there's one that says other schools because they're everyone in Rhode Island and a few others nearby, because there are many dozens and dozens or more of places where CNAs working and licensed in Rhode Island may have gotten their original training. But to make it useful, we have made it possible to select just one or just ones in Rhode Island, or maybe we want to compare this one called HITEP with CCRI. Well, again, we'll do that Control Select to be able to select two things. And now we see just those two. And we can compare them both based on the total number of CNAs that they've trained, the percent that have gone beyond CNA, big difference here. percent that have gone on to be RNs. I will note that some of the nursing programs at times have required or strongly encouraged their nursing students to obtain a CNA license while they're in nursing school. So that probably does inflate the percentage of the appearance of CNAs, people who got their were started as CNAs and then became registered nurses. Okay, but all the same, that's, you can see that. And then we can also actually look at what was happening during a particular time frame with this cool slider bar. Anyway, that's pretty weedy and of great interest to some and less so to others. So that's a lot. I think what I'd like to do with the remaining 7 minutes is give you all a chance to share some feedback and or questions, things that were useful and things that are not useful, either on the dashboard or in this training.
Rick, I don't know if you can see when people have their hands up. But
Janet,
Janet
yes, I'm sorry, now I can. Yeah, so you want to call on people, Ariana? It's hard for me to see all of them.
Sure. I think it was Janet and then Elena.
Got it. Oh yeah, now I got it. Go ahead, Janet.
Amy,
Just barely.
my
Not hearing you.
Oh, is there any way to help with selecting and unselecting?
Janet, I don't know if anybody else can hear you, but I really cannot.
I can't hear her either.
I think she might be stuck at the bottom of a well. I'm just kidding. Janet, maybe
Well,
if you
while
wanna
she's
try-
climbing out, Elena, why don't you ask your question or comment? And
Okay, thanks.
Jen.
Thank you. It was a great presentation. Two things. I found the little quizzes very helpful. So, it would be nice to have an accompanying like handbook, maybe 1 or 2 pages just to say, here's, how to work it. And then, I may have missed this, but is there a reporting function?
you mean printing out what you find? Is that what you mean?
Yeah.
I don't.
I
think
think that might
s-
be a Power BI like function where you have to have an account.
Yeah, so there is not on this. There is not. So, for example, if this is what you're referring to, there's not the ability to export data, for example.
Okay, that's helpful. Thank you.
Yeah,
And
sure.
then if we had questions just in this kind of rollout, I have 2 questions. So if we had a question that we were interested in ensuring we understood how to get it, is we reach out to you and Ariana and Kristen, is that?
Yes.
Good, okay.
On the website, currently there is out, I think, maybe my email address, that we are going to create a healthcare workforce data email address.
Okay,
And that'll be a place to pose questions. We're also exploring the possibility, I don't know if this is going to be doable within the state restrictions, but we'd love to have a forum where folks could post both their questions and things that they have found and say, I just noticed this on the dashboard. It was surprising to me, or here's how I interpret it, or is anybody else getting the same outcome on the search tool? We are aware that the search tool has a lot of components, and it's not inconceivable that somebody might produce it or think they've got an answer and they, accidentally clicked or unclicked something. So we'd love to hear from people as to what you've found, and especially things that were surprising or interesting to you.
Rick, there's a question in the chat about the NAICS codes and whether it's possible to go down to the 6-digit NAICS code. And I can't remember what we learned about that, like if we could get to a more granular detail or if it's not collected that way.
Let me go to this. We can go to the 4-digit NAICS codes. I believe that's as far as we can go. Let me go to setting here. And we will select deselect
So-
this.
The example that Karen brought up was 6214 outpatient care centers.
Okay, is that, yeah, so under ambulatory care,
So if you,
Yeah.
yeah, and you go down the drop down,
okay. 6214, right. Yeah, that's as granular as it gets, which is pretty granular. I think beyond that, it would be very hard to suppress, data that might point to a particular provider, and that's, not
yeah,
something we want to do.
I think the concern was like within the outpatient behavioral health substance use arena, that those are right now embedded under outpatient. I forgot what the specific one, but it's under a fairly broad category, and so there was.
Got it.
maybe there.
Well, let's look into that.
Mm.
We can try, so outpatient BH, and did you say BH providers or substance use or both?
Yeah, so it was, sorry, just going back through here.
Yeah,
Outpatient
I
behavioral
can,
health-
I had posted the question, if I can certainly answer that.
Go for
There's, we find having both as an FQHC and a CMHC, we have both ambulatory care for health, dental, but we also have behavioral health. And when we're looking at salaries for an advanced practice RN, there's certainly differences between what a medical APRN might expect versus a behavioral health APRN. So those are the types of things that we were hoping to see a more broken down report to see what those salaries are in Rhode Island based on, mental health. I hate to say versus medical.
Yeah, no, it's a understandable question and concern. I would caution a little bit against using this as a salary equating this to a salary survey, because as I have
Oh, no, we would use it as a point of reference.
Yeah, yeah.
Absolutely.
But we can certainly look into what possibility there is for even more granular NAICS codes.
Thank you.
Other questions or comments? I guess we are at time.
I'm gonna take the one last one, Janice Spinelli's question about the
Yes.
opportunity to add more data, including the certification board.
Yeah, there are potential opportunities to add more data. The data has to sort of fit in the ecosystem structure. We've looked into the certification board. Currently, they do not collect Social Security numbers. And that limits the ability, it actually prohibits makes it impossible, I think, for the ecosystem to be able to match the certification board's data with other data sets, like wage records, which tell us where somebody works and their earnings. So we've talked to the certification board. They would have to change their practice because we looked at things like first name, last name as an identifier, but the data analysts tell us that it's just not good enough matches. Even first name, last name, and birth dates don't produce.
I think it's even they might collect the last 4 of the social.
They do.
Which is not enough.
Right. So Thank you all so much. I hope this was helpful. And as I said, we're doing this again on the 21st at 11 o'clock. Feel free to register if you want to get a little bit more or reinforce what we've done today. And please do send us your questions and experience in poking around the dashboard. And yeah, thank you all very much. We'll see you again soon.